Today we have Sonal Patel, who is a pediatrician from Denver, Colorado. She has created an amazing business where she supports moms postpartum with all kinds of extra stuff. Today she's going to talk about that along with the reasons why she did that, a little bit about her birth stories and her postpartum journey with her 4 boys. We are also going to delve into why it's so important to have good information to prepare for the postpartum. This is something we definitely talk a lot about in our prenatal class. So if you're interested in learning more about that, you can check out the link below. We also go over our top 5 tips for the postpartum journey and how to make it the best. So we'll get back to that right after this. Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Welcome, Sonal. We are so excited to have you today on the She Found Motherhood podcast. Why don't you start off by telling us a little bit about yourself?
Definitely. Well, thank you so much for having me and letting me this opportunity to speak. So my name is Sonal Patel. I am a board certified pediatrician. I'm also a neonatologist and a breastfeeding specialist. And I have 4 boys, and my husband's a trauma orthopedic surgeon. So there you go. You've summed up my life. It's a crazy, wonderful life. And yes, I don't think I'd want it any other way. Maybe a little less bills for groceries might help a little, but yes, definitely.
How old are your boys?
So my oldest is going to be 15, and then my youngest is 5.
So that is the grocery bills you're talking about.
Exactly. No, I was talking to another family recently, and we literally will go to Costco every week just to get him a chicken for himself. Like that's his chicken. That's not even the family's chicken. It's just like, thank God for Costco, I would say.
Indeed. Hey.
Yes.
And tell us about your business, because you have a pretty special business that you have created. And I looked on your website and it looks incredible, the services you offer to moms and babes. But I would love if you would tell us a little bit about it and what prompted you to create this business.
Definitely. Thank you. So the niche is postpartum care. And honestly, if you go on my website or read it, it was because of professional and personal experiences. Like I said, I have 4 babies, and each one of them had a different results. So meaning each one was different. So my first one was a C-section. My second one was a VBAC with the grade 3-4 tear. Then I had an all natural, unintended, like literally made it in time to deliver. It was actually at the hospital at the time that I was working as a NICU. And I said, oh, thank God I made it, because it would be such bad news that the NICU doc delivered in the parking lot, and we've been taking care of those moms on the other end. And then in my 4th one was what really prompted me to reevaluate postpartum care in the United States. I had preeclampsia with my 4th. There was another VBAC. And due to the preeclampsia, usually I would have some good family support. Like my mom's a family physician too, but she would come over, followed by my mother-in-law. But because of the preeclampsia, I had to deliver early, and all of that kind of got messed up. And I just found myself taking my 3 boys to school, and then this little one to their 2 to 3 day post-hospital appointment. And you guys are up in Canada, because we're in Colorado. Like, it snows enough to not have everything closed, but you're just kind of questioning while you're on the road, like, why am I here? I came back and super exhausted. Yeah, so my husband was asking what happened at the appointment, and just reflecting back at the appointment, it was 10 minutes at most. I believe a nurse or a nurse practitioner came in, so I didn't even actually physically see a physician. Put a little strip on my kids' those heads and said, you know what, this 4th time breastfeeding, you'll be fine. And then I was gone. And I was like, are you kidding me? Like 10 minutes. And I go, all I needed was a weight check and somebody to check if I was breastfeeding fine. And I mean, I write about it too, but I spent literally 4 hours for 10 minutes. And it just did not seem, there was something wrong with that balance. And that was one of the most eye-opening visits, and then reflecting back in all your other deliveries, you're like, wait a minute, I had a C-section. At that time, I'm living in an apartment, 3 flights of stairs, and you just went up and down, right? And you didn't think twice about it. And I was like, there has to be a better way. And so that prompted me to open my business, which is Naya Care. Naya used to be my girl's name. So Naya means sunshine or renewal. And the impetus is really to provide postpartum care for the first 2 months and also 360. So for me being a pediatrician, why I could do it, because we in the United States, we demand so much of the pediatric visits in the first 6 weeks, as opposed to the OB visit. So that felt like, okay, I can start somewhere there. But then also not only breastfeeding support, so then moms aren't trekking or to different lactation groups, or they're not, it's like a one-stop shop type of deal. I also evaluate for anterior tongue ties. So it's like, okay, let's clip it. Let's kind of get this going, as opposed to now you're struggling for a couple of weeks and then you're going to the dentist and they're like lasering everything in the mouth at that point, and poor kid has to relearn how to eat. And then lastly, it was the counseling. So that was very important because I suffer from postpartum. So we always have a counselor checking in. It's a mom check-in. And then a pelvic physical therapist, just because I've had some healing issues of my own. And I discovered pelvic physical therapist literally after my 4th. And I was like, every woman needs to know about this.
Yeah, it's so true. And I think even before I started having babies of my own, I had no idea about pelvic physio and the amazing things that they could do. So we certainly start recommending that in early pregnancy for our women here. And your services, you go to mom and babe. Is that correct?
Yes.
Yeah.
Like taking that burden and that pressure away. Sometimes you're thinking like, why am I doing this? You always question it, right? Because it's not the norm. It's like, oh, I should be just in a clinic. But then you get that mom that's hobbling to the door, hunched over, and you're like, this is why I do it. It's not for, definitely the medical visit is there, but it's just like, you just delivered a child, So, but yes. So all at the house.
That's wonderful. And certainly in Victoria, where we are, there's 2 providers who provide care. So 2 options. One is family practice and the other is midwifery. And the midwives do home visits postpartum, which is an incredible thing. We unfortunately we're paid in a different way. And so we're all funded by the government, unlike the States, right? Mm-hmm. And so we're paid in a different way. And the midwifery care is paid much more significantly for postpartum care. So they are able to financially kind of do those home visits, which is so incredible for the moms and for the babies. We are not paid in that way. We're paid much less for postpartum care. And so as a result, we do have moms and babes coming in to the clinic to see us, but certainly the focus is on both mom and babe. But yeah, it's a different model of care, and it would be wonderful to be able to provide that service. But unfortunately, just because of the way that we are remunerated in Canada anyways, it's very challenging for family doctors to do that. So in terms of your, it sounds like you have a pretty comprehensive team. I'm assuming, again, this is kind of private pay, or is it covered by insurance? How does that work out for you?
Yes. So the difference of the insurance model. So Medicaid is our government insurance over here, and they do reimburse. They don't reimburse that well, but that is the only insurance I will take, because the private insurance companies, what happens is that it's not a blanket. Like if you have Cigna, it doesn't mean if it's going to be covered or not, because Cigna might have 20 plans underneath them, or Blue Cross, Blue Shield, and so forth. So initially we were trying to take insurance, and I think we're going to go back to it. However, it's just a pain in the butt. Like you spend so much more hours chasing bills down, and even from the family side as well. So my feedback from my families are like, you know what, we value this. Please give us a super bill, or please, we can use our HSA account. Or I actually had one aunt give it as a gift, actually.
That's such a special gift.
Yes. And she's
oh my goodness. Yes.
So that was like, I want to give you this as a gift. And so there is different models of payment that people will give, but once they go through it, they're just like, I I mean, I've had moms who's had their second or third, and they're like, we wish this existed prior. And I'm like, I wish it existed when I was having kids, you know?
Right? I wish it existed here. So
So
anybody in Denver, Colorado, if you
yes,
have a baby registry, put on Naya Care as your baby registry gift, right?
yes, yes,
So brilliant. That's so
yes.
that would be such a special gift. So tell me, what were I would like to ask you two questions before we get in. We're going to do kind of top 5 tips for postpartum or moms.
Mhm.
But I would like to ask you, I'm putting you on the spot a little bit. What is your specialist moment after having a baby? And what is the thing that you struggled with the most after having a baby? And you can just choose one baby or all 4. It's totally up to
Okay.
you.
So I think my specialist moment with all 4 of them, because I just remember with every single one of them, the midnight feeds or the middle of the night feeds. And it was just me and my baby, and the moon was shining. And I always remember the moon shining. And it was that, and then the moon would literally reflect in, you know, those full moons, those bright moons that you think it's like, is it really daylight outside or not? And I was like, I try to absorb that moment. And I had it with every one of my kids. And I think that was the most special because no one else experienced it. And yes, yeah, I was up. I mean, I was hurting, all of that good stuff, but it was very angelic. And talking about it too kind of makes me a little emotional, but it was very special. Oh. And then the struggles. So I talk about my struggles a lot. Postpartum, I did not know, I think depression's a misnomer. I had a lot of anxiety and anger, and I didn't realize that was part of the depression packet. I had full-blown depression as well too. And then just healing, you know, I mean, a C-section with my vaginal, with my grade 3s, grade 4s, I ended up having an infection, a uterine infection to go along with it. When I had the third with all natural, and that was like ideally the best recovery, you know, and painful to have it, but a really good recovery. I think that was a thing that the most challenging, I mean, with my 4th, the high blood pressures, they can barely get up. I mean, I've had a spinal tap headache. Luckily, my anesthesiologist gave me a blood patch within like 30 minutes. So kind of just very eye-opening of the struggles that happen. It's not the Hollywood hallmark recovery, and there really are major struggles, and you know, it's just to respect that time period too. So
Yeah, I think we don't often, I find it a big challenge kind of talking about postpartum recovery because it's something you're going to go through. And really, we should be prepared and we should have a knowledge of what that could and often does look like. But it's also kind of frightening to talk about it to women who've not gone through it. So if your first pregnancy, having those discussions, you want to warn people about it, but you also don't want them to fear it because it is also such an incredible time. It's such a, like, it's one of those times that's like highs are so high and the lows are so low. And trying to explain that to people is really challenging unless you've gone through it. But it is so interesting how each of your 4 babies were very different recoveries and very different issues. And I found the same. I've got 2 kids, you know, my son, he came home with me right away. He was born, you know, he was post dates and we'd had an induction, but everything went really well. But the breastfeeding challenges were huge. And had I known then what I know now, things would have been a world of difference. And then my daughter ended up being in the NICU for 3 weeks, even though she was born at 37 weeks. And that's just kind of life. And I ended up with a stat C-section with her. And so that recovery was so different, even though in my mind, I was expecting this like wondrous, easy, like quick delivery. She was 2 pounds smaller than my son, but it all just went sideways. And so I luckily had the knowledge around that. And so I could, you know, prepare myself after it happened and knew what that recovery might look like. But I think it's such a challenging thing to kind of have those discussions with women going into delivery about what postpartum could look like. And certainly we did a huge podcast on preparing for postpartum, like nests, and pulling in your support systems and those types of things. But it's a hard discussion to have with people kind of preemptively. But then it's also challenging to have it afterwards because you wish you knew more about it to prepare, right? So
yeah. And also like that social, I guess, social underlining bias that, or whatever you might call it, is that women are just supposed to bounce back. Like we're just supposed to be like, oh, we're done recovering, or we've had this baby. And I think talking about it to have people aware, but the other part of it, the resources, to be like, okay, you know, if you have this, these are the resources that you need, or if you've had this, these are the resources. And also to kind of normalize it as well, you know, to be like, no, postpartum recovery can look different. Like you highlighted with your 2 and with my 4. I mean, there's 6 babies right there between us, and we're only 2 people. And just to be like, highlight that aspect of it, that yes, you can get these things, but it's not necessarily you get these things. But if you do get these things, this is actually normal. And some women, most women do go through this. So
yeah. And I also don't think we talk about that 4th trimester enough, right? It like every other trimester is a 3-month transition to having your baby, to then, you know, figuring out life and getting kind of your body kind of back and learning how to cope with it as a parent, as a co-parent. Like it's a big transition, just like each of those other trimesters. Like you said, we kind of social media and everybody says, let's just get back into it. Let's get back to our life. But it takes time, and giving yourself the grace and the patience and being kind to yourself over that period of time, I think is one of my biggest top tips. We're going to get to that soon, but we don't also talk about that. So it's just an interesting thing, like you said, how the expectation is that we just get back into it. And I know in the States, you guys barely get any mat leave at all, right?
Oh, no. So I was part of the paid family leave legislation. I've been for a couple of years, and we actually finally passed it in Colorado this year. So super psyched and excited about that, for moms to actually have an opportunity just to be with their babies, you know, to have those moments where the moon is shining and not be like overwhelmed with it. So, and the other thing, like I find, is that if I objectify stuff, it's easier for the men and their partners to understand. So for example, you know, the reason we need 3 more months is because of evolution. Our brains are too big. So in order to handle a baby coming out, it has to come out earlier. Otherwise our pelvises needed to be huge, you know, and then we became upright, and that's why our pelvises were small. And to put that objectiveness in women's care, I think it really helps for men to understand what we're going through. You know, I talk about postpartum depression or the blues, and realizing how progesterone, the hormone, is 8 times higher. And then you deliver between birth and 24 hours, it's really low. And then I will see my fathers being like, oh, that makes sense. Yeah. And to putting numbers onto our health really helps understand, maybe for a bigger society too in general, to be like, okay, this is what we're really going through, and stuff. So
For sure.
mm-hmm.
So why don't we get into your top 5 tips?
Okay. So the first tip definitely is, and everybody says self-care. And so my thing is like, okay, let's really kind of put self-care in postpartum terms. It's not this luxurious thing that you're going to get, but 5 minutes to step away from baby, being a mom, being a wife, being whatever label you have. Like if your mom's there, you're their daughter and stuff like, and like literally 5 to 10 minutes, step away. No electronics. Okay. So some women are like, well, I really like to read or really like to journal and stuff like that. Fine. 10 minutes, 24-hour day, definitely start there. And so then it just makes it a little bit more easy and like to handle. So it's like, you're not asking 20 minutes a day or 30 minutes. Like, no, just 5 minutes, just step away from everything. You'll be fine. So that's one. Second, every mom in a 24-hour period has to have a nap away from baby. No monitors, no nothing, you know? And the reason behind that is you get into your REM. So even if your nap, again, it's not this glorious 3-4 hours naps, because your babies, they're gonna be hungry, but this 45 minutes to an hour will get you in your REM, and then you're up. So those are my first week tips, okay? And that self-care portion of it is also for them to realize that it's okay to start with 5 minutes, and then hopefully over time it will build. Second week is, now that you're kind of feeling a little bit better, hopefully there's nothing too much, that you and your partner go on a coffee date, drive-through coffee date, okay, for 15 minutes. I never say lunch and I never say dinner, especially for first-time moms. It's really hard to leave your baby. You know, it's just like, wait a minute, I've been with this person for like 10 months and you're asking me to go things. And also I remembered myself having dinners. My husband was awesome. He would take me out to a dinner, but then I'm like, when is this over? Like, I want to go home. Like, I'm hurting everywhere. So that would be my third, is 15 minutes just to kind of step out. Usually there's another family member there that can watch the baby for 15 minutes, but to really regroup with the person that you've adventured into this new adventure. I'm going to actually go back. So I do have, I'm not sure how it happens there, but here in the States, we do have the golden hour, the first hour the baby's born to let it breastfeed. And I always say, well, the second one has to be, I call it the platinum hour. So with either the partner or dad or whoever the person is there to do, for them also to do skin to skin. And then announce to the world that you've had the baby, because once the world comes in, it never leaves, right? So to really take that 2.5 hours of that time to be like, hey, we did this. We've created this family. And that tip I actually learned from my husband. He'd be like, no, I just want to be for a minute, you know? So that's that one. So 2, 3, and number 5 is really pelvic physical therapy. Every woman should have pelvic physical therapy. So that's life-changing. So those would be my 5 tips. I think I got 5.
Yeah, no, you totally did. That's great.
Yeah.
So number 1 is skin to skin for hour with mom. And that is great for hormones, for baby regulation, for baby there's great evidence for kind of improved breastfeed. If your plan is to breastfeed, improve breastfeeding long-term, how like exclusive breastfeeding, etc. Number 2 is platinum hour. So time with dad as well, or that's all part of the same one.
No,
right?
no,
And
that's 2. Yeah, go ahead.
Separate ones. So platinum hour, time with dad, and time to just spend as a family unit, because this will never happen again.
Right.
A second baby is a different experience. This experience will never happen again. And you guys have been waiting for this for so long. I agree with you wholeheartedly. Enough with the social media, just be together as a family, and then you can announce. Yes. It's interesting. And we have probably you guys as well. We don't have visitors allowed, only 1 visitor allowed postpartum. And the breastfeeding rates have like improved dramatically because we don't have people coming in and out of the labor delivery room and the postpartum room. So moms and babies and their partners can actually just be together, lots of skin to skin. It's been incredible for that. It's been challenging for other reasons, obviously, but that's one of the positive that's come out of it. And then the other one was self-care. So taking 5 to 10 minutes a day just to step away and do something that you enjoy doing that is not screen time related. So reading a book, having a quick bath, going for a walk.
I enjoyed a cup of tea in my sanity, you know, or just stepping outside and breathing in the fresh air. So it's really not very, and no dog walking. I've had moms say, oh, I'll just take the dog. No, that's a responsibility. Like, no, none of that. Like literally 5 minutes to yourself.
So, look at a trashy mag, whatever. Right?
Yes, exactly.
Yes.
Exactly.
Okay, good.
Yes.
And then an uninterrupted nap. Well, a nap away from baby. And this one I always tell my new parents about is this is the one time I think tag teaming is a great thing. Well, no, that doesn't make sense. But do your last feed of the evening. This is what I suggest to people. But during the day, if your partner's home as well, go to bed, put in earplugs, put on a sleep mask. Your partner, who you, again, chose to do this with, wants that time with their baby as well. They want that special time. It's so wonderful. They can have skin to skin time or snuggle while they're watching a movie or doing something else until baby needs you again for a feed, and then they'll come get you. But then you know your baby is safe, because I know a lot of moms, I certainly did, have huge anxieties of is my baby breathing? They're sleeping. Are they alive? Are they okay? And it's so hard to get that kind of that sleep when you're so worried about it. Whereas if your partner's caring for your baby, you know they're safe, right?
Yeah, exactly.
And then the 5th one, I think, was hot coffee date with your husband or your partner, whoever you chose to do this, to reconnect.
Yes. Yeah. And I think establishing that, and, you know, you have older kids and I have older kids too. It's just, you have to reconnect. You have to take that time to reconnect as you venture into parenthood, because then what is it for? Like, what's the point for it? Because you know what? 18 years are going to leave you anyways. And then you'll be like, who are you? And you don't want it to be a stranger. You want to enjoy your life that you're creating with the person that you're creating with. So to kind of reconnect. I mean, now we do, well, not in COVID world, but we used to do date nights, and my boys were so used to it that they were like, they would tell us that we haven't been on a date night, So I think that's really important. And it starts with that 15-minute coffee date. So
Totally does. Totally
yeah.
does. This has been a wonderful chat. Thank you. Where can people find you? So either locally, how can they get a hold of you if they're interested in learning more about your services? Because it sounds like they're fantastic. Or kind of more remotely, is there anything that you can offer kind of from a more remote perspective?
Yes. So definitely locally, it's nayacare.org is our website. Any social media platform, Naya Care. I think Facebook is Colorado and Instagram is just Naya Care. And then those are some local stuff. And remotely, I do offer breastfeeding support. We are actually, hopefully this will work out, but in December, we're going to launch a dads group because a lot of my dads are expressing that they're like, Dr. Patel, they have all these moms groups out there, but we're kind of lacking ours. And then the cohort will try to be in the 2-month range. So we're not going to have dads that are like, the babies are 5 years old, because they're also needing that immediate support. And we know dads, a percentage of them do go through postpartum degree of depression as well. So we're going to start that in December. So please look out for it on social media. And if you have any dads anywhere, anywhere, it's on social media, it's going to be a Zoom. It's dads to just come together and figure out from their lens what support they need. So I guess.
Awesome. Yeah. So lovely. Well, thank you again for coming and joining us. It's so interesting learning about different systems. We kind of chatted before the podcast started about the differences between our system, but it's different everywhere. So it's wonderful that you are providing this amazing service. And thank you for doing that and for taking care of the mamas.
Oh, thank you so much for giving me a platform to talk about it and be like, we need to change this. So thank you.
We do. All right. Have a lovely day.
You too.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.